Hi there, Johannes Keating here. This is for you therapists out there. Today I'm going to talk about a phenomena or a defense that I call pulling out the rug from underneath. And this is where there's been an episode of increased emotional intimacy and closeness between you and the patient. But then the patient deals with their feelings about that increase in intimacy by distancing from you. Again, and they do that in the form of second guessing the reality of the previous episode of intimacy. They're doubting it and second guessing it. And so that could be, I think I was just being compliant. Or, I think those feelings were actually fabricated. And that can happen, a minute or two after the increase in closeness, or that could happen in the next session. And the increase in closeness, that could be that the patient experienced a measure of their complex transference feelings. That could be that they were particularly open and vulnerable and maybe acknowledged something that they normally wouldn't. And for some, it could be just allowing for some common ground between you and them, some shared understandings. That level of intimacy could have been enough for some to mobilize complex feelings and anxiety, and then the pulling out the rug from underneath, the distancing through second guessing the reality of what just happened. Now, it's certainly possible that the patient may just have been compliant. It's certainly within the realm of what's possible and what does happen sometimes that it was fabricated to an extent. The patient was performative, and the patient could be simply honestly reflecting on that previous episode. And if that's the case, then it's a really good thing that they're bringing this to your attention and that they're being honest about it. And so, as you can imagine, it's of course extremely important to tell the difference. What are we dealing with here? Are we dealing with a patient who's being honest that they were being compliant and performative and fabricating? Or are we dealing with this defense that I'm talking about today, which is the pulling out the rug from underneath? And there's different things to attend to as you try to sort that out. One is your own perception of the previous episode. How sincere and real did it seem to you? What was going on with the patient's anxiety? Attention to the psychodiagnostic markers and all of that. There's also the importance of the circumstantial or the contextual information. Has the patient shared with you a picture where it's clear that they're structuring their life to avoid people? Are they heavily isolated? Essentially, is there evidence of global and pervasive need for distance and conflicts around emotional intimacy? Because insofar as that's the case, then why would you be an exception? Insofar as that's the case, then certainly you could expect that to be a major, prominent dynamic in the therapy with you and the transference. So things like that can be helpful to attend to when it comes to really sorting it out. The other thing you can do is simply bring it to the patient's attention as a hypothesis, as an interpretation. You could say, is it possible that what you're doing right now is pulling out the rug from underneath something that actually was real, but by second guessing it, you are again pushing me away? Could that be what we're looking at right now? And the patient's response should also be clarifying. And so this defense that I'm talking about, the pulling out the rug from underneath, it's a close cousin of the defense that I call jerking around, which me and Salvatore did a video on a couple of years back now, maybe. Basically, it was a role play, and Salvatore, a colleague, a therapist in Italy, he simulated a patient who engaged jerking the therapist around. The difference, by the way, I'll include a link to that video in the description section in case you're interested, in case you haven't seen that. It's a pretty interesting video. But the difference, to my thinking, between the jerking around defense and the pulling out the rug from underneath defense, this is just how I think about it, but it's that with the pulling out the rug from underneath, that's on the heels of genuine emotional intimacy that really has been facilitated, that really has occurred. Whereas the jerking around tends to occur without there being much intimacy at all. So, to my thinking, that's the distinction between the two. So, okay, I think that'll do it for today. I hope I gave you something to think about. And thanks for watching. Till next time. Bye bye.